Well, you know, he stated it all. I mean, there's nothing else that I need to add to the testimony that has been given. He's put the responsibility in your hands because you're the one that governs. You choose the one you want to lead. We're your service. We are your public service. And anyone that does not support House Bill 311 is not in your best interest. So, thank you so very
much. Now, I have no story like Kyle's. And my heart is breaking for you, and I'm praying for you and your family. But from another side, a quick story. I'll just say one. I injured my back in January. I went to urgent care, and you are so right. I went to urgent care. I said I can't walk, I can't stand up, I have numbness in my legs, I need help. And I was promptly given Vicodin and Flexerol. No real diagnosis, no pictures, no MRI, no nothing. Went to my primary care physician. I said, I can't walk, I can't work, I got numbness in my legs, I can't get out of bed, I need help. He gave me a refill on my Flexerol and my Vicodin and sent me to the doctor of osteopathy. So I went to him and I said, I can't walk, I can't stand, I got numbness in my legs, my back hurts. And he twisted me up like a pretzel and gave me a prescription for Valium. So then I went back to him a second time and they gave me a prescription for, what was it called? Soma. Now I'm a history professor. Okay. I mean, I'm in my classes and I'm sitting there thinking, I hope they ask a question because I have no clue what I'm doing because all that's happened is they just got me on drugs. So I went back to my primary care physician. Well, my father, who is a chiropractor, came and to give me an adjustment and said, you don't have muscle spasms, you have a disc problem. So I went to the emergency room and I said, I demand that you give me an MRI and check out my back. And he said, you have to go back to your primary care. I can't give you an MRI for your back. Here's some Dilaudid, which is morphine. Okay? So I go back to my primary care doctor and I said, look, I demand you give me an MRI. They gave me an MRI and oh, lo and behold, I don't have back spasms. I've got a herniated disc in my back. It's 3 months later. Okay? So I said, forget it. I went to the chiropractor. I did my thing. I went back to my primary care for a check. And I said, look, I'm not going to sue you. I came in and I said, I have numbness in my legs. I can't stand up straight. My back is in incredible pain. Do something. And you just gave me drugs. Why did you do that? And here's what he said. Well, we have so many patients. We only get to spend so much time with each of the patients. You came in and said this, which equals back spasms. So I gave you this, and that's supposed to make you all better. So if HB 311 can prevent the, the answer of put them on drugs and 30 days later they'll be all better because they've just been stoned, then I would be very appreciative. Because I'm telling you, and I'll be done with this, but it is true. I heard it on a comedy skit, but it is true. The system is designed to just put you on drugs. The system's not designed to diagnose and treat the root. It's designed to have you on so many drugs that you just basically forget you were hurt. Right? And then it takes care of itself, maybe, and that's it. Or we just keep, I've still got my Vicodin prescription, and it's got, in essence, unlimited refills, because his whole issue wasn't to solve my pain, it was to put me on the drugs. So we need HB 311. Okay, thank you. That's my